Welcome back. It's been said children are our greatest asset, our future. Yet nationally, a report of child abuse is made every 10 seconds, and nearly 3.3 million reports of child abuse are made annually. We here at the DHHR joined our partners around the state and across the country in April to raise awareness about the problem as part of Child Abuse Prevention Month. We'll take a look at what our agency is doing to combat the problem and how you can help victims of child abuse here at home. But first, we hear from a child abuse survivor, a TV news anchor in West Virginia, speaking out for the first time about his traumatic past. Sarah Lou has his story.
News at 6.
I'm Greg Carter. Before we get to our top story, we have some breaking news out of Mercer County.
Tazewell, Virginia native Greg Carter has covered it all.
Approximately 15 families are homeless tonight. He's been quoted as saying that the Democratic Party. We've told Amy Lambert's story before.
Now, the evening news anchor and reporter for WVVA TV in Bluefield, West Virginia, is telling his story, unveiling a disturbing past to shed light on a growing problem.
I'm 6 foot tall, 250 pounds, African-American man, and by the way, I am a survivor of child abuse, and I really stress the survivor part of this. I was physically abused by my biological father from as early as I can remember until around the age of 8.
That's when his father left and didn't come back. Greg is speaking up as part of the West Virginia Child Advocacy Network's One with Courage campaign in an effort to inspire others to take action against child abuse. He spoke more to us about what happened.
It ranged from using a belt to using a switch or a tree limb or something. It was enough to produce significant markings on the body.
The triggers were as random as the events themselves. A bad grade, making too much noise, trying to protect his mother, who also was a victim.
There were times where I remember my peers waiting outside so that my father would hit me and then he would push me outside so that they could see and sometimes count the scars on my arms and my legs and my back. So my friends would count them and make fun.
And the pain didn't go away when his father left.
As I grew up, I suffered from night terrors, especially through the middle school years. I remember nights where I was truly afraid to go to sleep.
The respected and award-winning journalist, known for his easygoing personality, community volunteerism, and a proud father of 3 girls, told of teen years filled with insecurities, avoidance, and anger. For him, it was a sign of weakness to tell. Besides, there were no professional advocates at the time where he lived, but he did have a spiritual one.
My great aunt, who will be 94 years young next month, God willing. She sheltered me, she sheltered my mother, she protected me, she became my hero. And that's what abuse victims are looking for. We're looking for just one adult, anybody, with the courage to step up and speak out, one adult who will stand in the gap for a child and advocate on their behalf.
His great aunt became his one with courage.
There was a house right here.
As he grew older, Greg immersed himself in his career and helping others, thanks to his one who believed in him. But the trauma is still difficult to shake. He wants victims of child abuse to know it's not their fault.
You've got to let go of the shame, but it's hard. It wasn't you. You didn't do it.
Greg believes his healing would have started sooner, and his life may have looked different if there had been a child advocacy center in his community. He says all it takes is one adult to make a difference.
Maybe it's you, the basketball coach, who just can't understand why one of your players is lashing out at his teammates in anger, but then doesn't want to leave and go home after practice. That was me. Maybe that one person is the parent of a child whose friend is just consistently showing signs of physical or mental abuse, sexual abuse, but you're just not sure what course of action you want to take. I was hoping that there were families out there that would see my cries for help and would say something.
His hope, maybe that one adult, is you. For the State of Health, I'm Sarah Lou.
And Greg Carter also recorded a radio PSA that's running statewide to bring awareness to the issue, break the silence, and inspire adults to action. Joining me now to help us discuss raising awareness in West Virginia on issues and services available is Nancy Exline, Commissioner for the Bureau of Children and Families. Thank you so much for being here, Nancy.
Thank you for inviting me.
I know that throughout the month of April we celebrated Child Abuse Prevention Month, and there was a lot of activities that went on in the DHHR. Can you share some of those with our audience?
Absolutely. We this month were out in all of the communities statewide working with Prevent Child Abuse West Virginia. It is all over the state. We do different things with pinwheels. We do different types of activities around the proclamation of the governor about abuse and neglect. These types of activities allow communities to get out information that all West Virginians need to know about how they can report, how they can know about abuse, neglect, and the things that we need to do in this state to protect our children.
Pinwheels, that's an interesting concept. Can you tell us why pinwheels is associated with child abuse prevention?
Absolutely. Several years ago, there was a grassroots effort in places in Georgia and Virginia and Ohio, and it was to make a national symbol that was about more than just child abuse, but that it was about prevention. And the pinwheel represents the fact that children are able, and that we as adults all have an opportunity to make a difference, that we have an opportunity to change the way that we do things. It's a reflection on hope and health and safety, and really what the Bureau for Children and Families is all about.
That's great, because I think it's important for people to understand that, and the pinwheels, that representation of that, I love that concept because I think it makes sense. Why is it important for people to be aware of child abuse and what they can do?
Well, you know, children, statistics tell you nationally that a child that's been abused, they are more likely to have health problems that you've already talked about today. They're more apt to have emotional problems. And that pinwheel, if I go back to it, you know, the real story behind it is that it's your turn to make a difference. And so it helps us to understand that catching child abuse and neglect early is a way in which we can help children, but not just the children, but also the families. So it's so important for us to be able to catch things early and to be able to prevent things for the future and to help children and families to grow and to be able to be productive citizens.
I think that's key. I do think the audience, though, wants to know a little bit about what types of child neglect, child abuse should be reported, because I do think we are responsible as a community to make sure that we're reporting accurately.
Absolutely. There are so many different types of abuse and neglect that are out there. Some of it is emotional, and sometimes we don't think about the fact that a child can be emotionally neglected, and they can be physically harmed. There is sexual abuse that is out there, and then there's just neglect, that a child is not going to school, that they are being neglected, and that there's not food and shelter that's available to those. The most important thing for our citizens to know is that each of us can make a difference by stepping in early. If you see a child that appears to have these types of things going on in their life, or that you just have questions about their behaviors and how they're acting out, make a report. Come and be part of that so that you can make a difference in that child's life.
Now, one thing that everyone always asks is, who should we contact? How do we report child abuse and neglect?
Secretary Bowling, we this year did a great thing, I believe. The Bureau for Children and Families and with the Department of Health and Human Resources, we took our hotline, which is what was called for reporting abuse and neglect, and we did it statewide, and we call it centralized intake. It's one number where you can call to report any type of abuse and neglect for a child. And that number that can be reached is 1-800-352-6513. It's open 7 days a week, 24 hours a day, 365 days a year. There's a licensed social worker on the other end of that call that you can ask questions, you can report things, and they're going to ask you a lot of detailed questions, because the better a referral is, the better that we can serve a child and a family.
And would you say that one thing I think for all of us to be aware of is that it's best to report anything suspicious? You know, I know sometimes people hesitate, well, I don't know, or I'm unsure. But the bottom line is report and let the experts give you the information and let us investigate so that we can intervene early.
Absolutely. That is the number one important thing. You don't need to make that decision for yourself whether or not it's abuse, neglect. It's up to the experts to make that decision. Always report. Always take the opportunity to call and let someone take a look. It's a child's life that is at stake, and those are the things that we need to be able to do.
Absolutely. Commissioner Exline, one other thing, I want to acknowledge all of our child protective service workers and adult protective service workers. They do a phenomenal job out there in the field. It's hard day to day. Tell us a little bit about their job and the challenges they face.
You know, our child protective service workers are oftentimes overwhelmed. They see the worst that society has to offer. And they have the ability, once we receive those referrals, to go into homes and to check out what is actually going on. We all know that substance abuse is rampant in the state of West Virginia. And so they are going into harm's way sometimes to step between what is going on in a home and a child. They do an incredible job. I cannot say enough about their compassion and about them being the champions for our children out there in the state of West Virginia. Just a great group, and I'm humbled to be the commissioner that serves under this group.
Well, thank you for that. I think it is important for our viewers to know the hard work that goes on each and every day in your bureau, and you as a leader, and I too am honored to be part of something that's so important for the state of West Virginia. Is there anything else that we could tell viewers they need to do to help prevent child abuse and neglect?
Really, I think the most important thing is being educated. Understand what child abuse and neglect is, being able to recognize signs and symptoms that may be in children that you interact with, whether it is in a school or your church, your community, your next door neighbors. Knowing what is and is not child abuse and neglect, and then taking action. Making those phone calls, trying to help those children out, being proactive.
I also think that there's a role for our community. I think that, you know, West Virginia, I love this state and the people in it because I believe we are very community minded. I think activities that go on community help children. And do you think that's part of really just continuing to be focused on children?
Absolutely. Anything that we can do to work with children is very much important. It's important that people are engaging, that adults are always engaging with children, because you'll be able to see if there are things that need to be helped, if a child needs help in certain areas. Always being involved.
Well, thank you, Commissioner Exline. I really appreciate you being here, and I thank you for you and your team and all of those in our DHH offices for serving the people in the state of West Virginia.
Thank you, Secretary.
And speaking of protecting children, when we come back, we'll take a look at the exciting new pilot demonstration project our department is embarking on, and it's called Safe at Home West Virginia. Stay with us for news about Safe at Home.